So I just wanted to ask you, what's going on with Sertoli?
Thanks. So it's Sertoli's 11th birthday today.
Oh gosh.
So as both a happy birthday present, I know he likes acupuncture a lot. It helps relax him, and I thought that would be a fun thing to do for his birthday. But he also, in the last year, has developed arthritis in both of his elbows. So he walks with a limp, and he is on a lot of other treatments as well too. He takes carprofen, an oral non-steroidal anti-inflammatory. He takes gabapentin, another pain reliever. He takes Dasaquin every day, and fish oils as well, all as anti-inflammatories. He's had shockwave therapy and acupuncture before on his elbows. It helped. And he most recently had intra-articular injections of something called Spring, which is hyaluronic acid and collagen, and that happened approximately 2.5 to 3 weeks ago.
Do you think that helped?
I do think I noticed more of a difference with the Spring than anything else so far. But like I said, he so enjoys the acupuncture, and I just feel like I'll throw anything at his arthritis to make him comfortable, especially if he likes it and enjoys it.
Yeah. So then for his personality wise, would you say he's more of like a laid back dog? Does he really enjoy food?
Yep.
Okay.
Food is life.
Oh my gosh.
Hugs and pets.
Yeah. Do you think he has any temperature preferences? Like we'd say he sunbathes a lot, or do you think he like seeks out cool surfaces?
He's a little hard to know sometimes. I mean, he definitely won't sleep in my bed the way the other lab does. So I think maybe it's a little too warm in my bedroom, so he prefers sometimes the cooler surfaces. But I also catch him every once in a while when I have an electric blanket and I turn it on, kind of drifting over to lie on the electric blanket.
Yeah.
So I think he does like warm temperature, but for a very short period of time, and then he wants to go back to cooling off.
Okay, and then would you say his like voice is normal? If you notice any differences in like his bark or his whines?
He has started to develop a little noisier breathing, which we think is laryngeal paralysis just starting to develop. But it's not as progressive as, say, his brother, his sibling. So it's just very mild at this point.
Okay, and then what is he eating right now?
Oh, he eats just food for dogs, beef and potato.
Oh, perfect. That's awesome. Great. And then what are your goals with acupuncture? I know he's gotten in the past, but do you have any like specific
for today,
goals?
Relaxation.
Just relaxing?
For sure.
Okay.
Because again, it's his birthday. It's about fun.
Yeah.
But I like to use it as an adjunct therapy to his anti-inflammatories to try and help with his arthritis.
Perfect. We'll get him all taken care of.
Thank you.
Yeah. So for the acupuncture appointments, we do what's called a PCVM exam, which is a little different than our traditional Western exams. So we look at their tongues and we try to do it least invasively as possible, just to get an idea of the color. And then we also are feeling all the extremities for any signs of heat or pain. And we use the back of our hand normally because it's a lot more sensitive than the top. Awesome, he's a good boy. I'm looking for anywhere he might be sensitive in his back. He's not reacting to anything. And then we also take pulses, which is a little bit different. So you'll see your normal doctors doing this, but we look in a different way to see if they're wiry or even, things like that. Can I have you stand up, Mr. Sertoli? Oh, thank you. Oh, good job. So we kind of just feel them. Oh, good boy. Good job. I'm checking all his muscles, see if I feel any heat over here. Good job, buddy. Awesome. Okay, so then now we can start putting his needles in. So part of it is I'm massaging, trying to find the acupuncture points before I put the needle in. So that's part of the fun, part of the relaxation. So we started with a permission point called byway. So it's just kind of the introduction into the session and then making sure that we have permission to proceed. And then now I'm doing a point that's the master point of the kidney, which controls the bones and trying Chinese medicine. And since he has some arthritis, that's why we want to treat that. Good job. This is going to be a local point because we think he might have some back pain at his TL spine. So I'm treating locally to see if we can help get him a little more comfort in here. Good job. This is another permission point, but it's really good for anxiety, so it can help calm them throughout the session. And I thread the needle through 3 points actually, but it looks like a little unicorn horn, so it's one of our favorites and the client's favorites too. Do you want to put one in?
Can you tell me?
So another point we're considering for Sertoli is called bladder 11, which isn't this one, but it's one that's the influential point for bone. So it's going to help with arthritis and things like that. So it's just a really good point. So you might notice throughout the session that Sertoli's leg is shaking, and part of that could just be Sertoli. But another reason is we might have stimulated a point that could be sensitive or a little bit painful. A lot of these acupuncture points are actually located at neurovascular bundles or the places where nerves are branching. So there's a lot of sensory nerve endings, a lot of like histamine release. So that can be a very powerful sensation that they're feeling. More local elbow points.
So the dog really doesn't feel it when the needle's going on.
So yeah, sometimes they can feel it if it's like a really like, I don't know what the right word is. If it's like a, we call it a zinger almost. So it just really stimulates and it's really powerful. They can sometimes feel that because when you put an acupuncture point in, there's something called Dei Qi, which is the Qi coming to that point, which is powerful. So sometimes they can feel that. So usually we let the dog sit from anywhere from 10 to 30 minutes. It just kind of depends on what they're here for and what we're treating. My average time would probably be about 15 to 20 minutes. And then when they go home, you can expect them to, sometimes they'll feel really good, they'll feel better. Other times they may be a little bit tired because this is a lot of energy moving and we're asking them to do a lot within their body. So sometimes they just need to take a great nap afterwards. But usually you should be seeing some benefits within like 1 day to 3 days. And sometimes it can also take a few sessions to see anything. So sometimes after the first session, we might not see anything, but after the second or third, we're starting to see the benefits. It just kind of depends on the patient, what we're treating, and how we're doing. So it's been about 15 minutes, so we're gonna go ahead and take Sertoli's needles out. And then I just rub my finger over where they were because we're trying to trap the Qi into the point. And we make sure we get all of them so that you don't go home with any needles. And then if the needle works itself out during the session on its own, that's not a problem. We just say they didn't need it anymore. So now you have all your needles out. So he's all done.